And welcome to the Dr. Bob Show. Do you know what symptoms of a heart attack are? 800,000 people in the United States will have heart attacks this year. And the underlying cause sometimes is obesity, diabetes, hardening of the arteries, elevated cholesterol, high blood pressure, lots of things that we can do to prevent heart attacks. We'll be learning about their symptoms and what we can do to get immediate help. My guest is Dr. Malcolm Foster. Dr. Foster is a board-certified cardiologist, and he'll be answering our questions. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about, did you know hearing problems can actually make you a candidate for dementia, Alzheimer's problems, and your pulse. Why does your doctor tell you take your pulse? What information can your pulse tell you and your doctor that will help your health? A lot of information for you. You'll want to stay tuned. We're talking with Dr. Malcolm Foster, board-certified cardiologist, and we're talking about heart attacks. And Malcolm, with you and I being 6 feet apart here, I'm going to take my mask off.
I'll do the same.
Yeah. Tell me, what is a heart attack?
A heart attack is a blocked heart artery where that part of the heart muscle downstream from the blockage does not get blood flow and oxygen.
So what are the heart arteries called?
They're the coronary arteries.
How many are there?
Usually 3, 2 on the left, 1 on the right.
Either any of those coronary arteries that seem to cause more problems than others?
Well, the one referred to often as the widowmaker is the one on the front of the heart called the LAD, left anterior descending, a big territory of heart muscle downstream.
So if that one's blocked off, sometimes it's a widowmaker.
Unfortunately, yes.
Yeah. What are the symptoms if somebody has a heart attack? Are there a group of symptoms where somebody knows they're having a heart attack?
The classic symptoms are heaviness, tightness, pressure, what we call chest pain, but usually heaviness, tightness, pressure, also shortness of breath, nausea, sweating.
Yeah, one of my good friends who had his first heart attack was a physician, and he said he knew what was going on. He had pressure in his chest and just huge amounts of perspiration that were occurring.
Yes, sir.
So that can be a common thing. Nausea?
Yes, very common.
Women, do they have symptoms different than men sometimes?
Oftentimes they do, and it can be challenging to diagnose a heart attack. They may just have a sense of unease or impending doom, the nausea, the shortness of breath, and not realize that it's actually chest pain central like that.
Now, the chest pain, the chest tightness, that's in the center part of the chest. Where is the heart actually located?
So it is in the center of the chest, right behind the sternum. Even though with the Pledge of Allegiance, your hand is over here, really it's almost dead center.
Okay. So, and I thought the heart was more on the left side of the chest. So it's pretty much behind the sternum also.
Yes.
And the pain, can it radiate anywhere? Does it go to the right arm, left arm, anywhere like that?
Well, it can go to either. Typically, it goes into the left arm, a radiating discomfort. It can go into the throat or the jaw. We've had people go to the dentist with tooth pain, and it was actually their heart.
Does the dentist recognize it?
They do. They have sent from the dental office to the emergency room.
So why is it important that somebody knows what the symptoms are of a heart attack?
Well, we say time is muscle, and time can be your life. Your life can depend on rapidly identifying the heart attack and treating the heart attack.
So a certain amount of time, do you have a day or 2 days? Or what do you mean by time is muscle?
Right, so we try to treat a heart attack within 1 to 2 hours from the onset. Is ideal to try to avoid permanent damage to the heart muscle.
So if somebody's having pressure chest pain right in the middle of the chest, and it's a squeezing pain, discomfort, break out in sweat, and they think they've got a heart attack. What should they do?
They should call 911 and come immediately to the emergency department.
So why wouldn't you want somebody to drive them right there? Because it takes a little while for 911 to get there.
It does, but we still want to call 911 because things can happen like arrhythmias and a person can collapse. So you certainly don't want to be driving or even be the passenger, because what is your driver going to do if you collapse? So it's definitely better to call EMS.
So EMS, emergency medical
Services.
Yes. What do they have on their ambulance?
Now, very importantly, they have equipment including a defibrillator where they could shock the heart if the heart went out of rhythm, and that's not at all uncommon.
So you can have rhythm disturbances. They know how to treat that. They can tell what the blood pressure is. They can get the symptoms and prepare the person. They call ahead to the hospital?
They do. They actually transmit an EKG, and we know ahead of time that it's a heart attack that we call a STEMI, ST elevation MI, myocardial infarction STEMI. So we call code STEMI in the hospital, and we're there waiting for them.
Ah, so that's what code STEMI means. Actually, we had you on a show about a year ago, and we talked about the STEMI.
We did,
and
yes.
We talked about the ST elevation with that. So that's good to know, because you're prepared when the person comes.
That's
when
right.
they come, so they come crashing in the doors like we see on television, or when they come through, how do you get them to the next stage?
So we try to take them very promptly to the cardiac catheterization lab, the cath lab, because that's where we do the heart cath procedures, the angiography, and we can treat the blockage with balloon or stent.
Now, if somebody's having a heart attack, that's a pretty serious situation right there, and you're going to put a cath into the heart during that same time. Does that present problems?
It can, particularly if the blood pressure is low, but we have the ability to get into blood vessels either in the wrist or the groin and thread those catheters to the heart.
So when you do the cath, what are you looking for? Are you looking for one of those coronary arteries that got blocked off?
That's right.
Is it easy to see?
It's fairly easy to see. We put x-ray dye in, and it really shows us right before our eyes immediately if there's an artery that's blocked off.
So if there's an artery that's blocked off, that means you're going to try and open it up. So how do you open it up?
We take a delicate guide wire and we thread that through the area of blockage, and we might aspirate or suck out some clot, but we generally proceed with balloon and then stent.
What is a stent?
A stent is a metal scaffold. It looks like a little spring that holds open the artery.
I call it a slinky.
Yeah.
So the stent reestablishes the blood flow. What does that mean to the patient? When you're looking at the heart that doesn't have any blood supply, and all of a sudden you open that up, and the heart's getting blood supply, what's it look like?
They get better right before our eyes. They go from clammy and sweaty and pale and distressed to pink and happy and laughing.
That must
Right before your eyes.
That must be amazing just to see that. So it's instantaneous that they.
It's incredible, yes.
So you know right away. Do you ever, when somebody's having a heart attack, do you see more than one blood vessel that may be blocked, or there's one major one and you can tell that major one?
Yes, usually one major one, but we may see other blockages, and depending on the circumstances, we may place additional stents.
So if somebody has additional problems, how many stents is a lot?
I would say 3 or more is a lot. More commonly, it would be 1 or 2. 3 or more would be a lot.
How long do those stents stay in?
Forever. It's a permanent implant.
So you've got a permanent reestablishment of the blood flow. A person that's in severe distress that suddenly wakes up and is happy and saying, "Can I go home?"
They ask that sometimes.
And when they ask that, do you know that there's some other things we need to get to work on?
That's right. And they don't go home right away. They need to stay in the hospital.
And we'll be talking about what you do next when we come back. We're talking with Dr. Malcolm Foster, and we're talking about heart attacks, and that's when one of the coronary arteries that supplies blood supply to the heart muscle will become blocked. And when that happens, the heart muscle doesn't get any blood supply, and we have to get to the hospital immediately. 911 to the hospital. If we can get there before 90 minutes, then we can establish in the cath lab a way to reestablish the blood flow. Now, is that a pretty good summary?
Yes, sir.
So let's talk about complications. If
Okay.
you get up into the cath lab and somebody goes south, they're having trouble, what can you do to help that person?
So we call that shock, and it's cardiogenic shock, meaning that heart attack is causing the heart to fail. And amazingly, we have catheter techniques now where we can place a catheter within the heart, a catheter this size within the heart, and it flows blood. And it can flow blood about 4 liters per minute or about 1 gallon per minute of blood flow, which is nearly normal.
So can you bypass the normal circulation? Does this device, what's this called?
It's called an Impella, and it takes blood from the left ventricle and it decompresses the left ventricle and gives blood to the circulation.
How long has that been available?
It's been available for several years.
And the purpose of it would be, if somebody's in cardiogenic shock, to keep the circulation to the heart and to the body going.
That's right.
How long does it have to stay in?
So it usually stays in for hours to a number of days, but that gives the patient a chance to recover from the heart attack, the heart muscle to recover, and it takes pressure off the heart.
I would take it that that patient was a little bit sicker than somebody else with a bad heart attack. I always tell people there's not anything such as a bad heart attack. A heart attack's heart attack. But is this person more difficult to get well over the next period of time?
Yes, they are. And we've learned to go early to support. We also call it a left ventricular assist device, or LVAD. So we've learned to go early to support to help the heart recover.
Yeah, it's amazing what the cardiologist does now to help keep people alive and back to a normal life. All right, had a heart attack. Now what do? We stay in the hospital overnight, but during that period of time, what are we designing? What's our boutique design for that patient to get them where they don't have a heart attack again?
Right. So now we become very motivated, and I talk about the whole package. So the whole package is eating right, cardiac rehab followed by exercise, getting the weight down, no smoking, and then being on the proper medications.
When you say a patient's had a heart attack, what percent will have been smokers?
Well, it's about 20-30%.
And it's a huge, huge problem. Do people stop smoking?
Many do. Now, sometimes they go back to smoking, and then we say, we got to quit again. But that's a good time to get their attention.
Yeah, it really, really is. And what are the other things we work on? You said rehab and exercise.
Right.
When do you start exercise? When do you start activity?
So they start, cardiac rehab is supervised exercise, which is an excellent option for somebody shortly after a heart attack, and then to progress to normal activities and normal exercise over time.
When do you start that exercise, that rehab?
The cardiac rehab, we start that usually a week or two following the heart attack.
So what is the cardiac rehab? You put them on a treadmill and they've got an electrocardiogram and you're monitoring their blood pressure or how they're doing while they're exercising?
Yes, it's actually a great experience because there are cardiac nurses that are in the facility and they exercise with good supervision.
You know, and I've talked with some patients that have gone through cardiac rehab and they say, in a way, it's like a social club because they're wanting to know how their buddy's doing and they're making sure that he's following his instructions and how he's doing on stopping his smoking. So we quit smoking, we learn to exercise. What do you do about nutrition?
So it's very important because this is generally due to plaque buildup in the coronary arteries. So nutrition is of the utmost importance, and we do nutrition counseling, and we encourage people to eat as heart healthy a diet as possible.
Do you measure their BMI, body mass index, to try and get it to a level that you want that person to be at?
We do, and for sure we like to get the BMI less than 25. And you can look on a chart and see where that is. Ideally, down around 22 is probably optimal.
I'd have to get skinnier.
It's pretty, well, me too. It's fairly slim. 22 is pretty slim. Going towards 25 or less, I think, is a good goal generally.
Yeah, and I'm right at about 25, and I'm always therefore saying, you know, you need to lose another 2 or 3 pounds, and you need to be sure you're eating properly and sleeping properly and getting adequate activity. Tell me about the cholesterol. What do you do about the cholesterol in this patient?
So we like to drive the cholesterol very low, particularly the LDL, the bad cholesterol. So LDL and triglycerides we like to lower and really very low, as low as possible. And we have excellent medications now. So it's diet plus medications. A lot of the LDL is genetic. So we encourage a healthy diet, but they probably need to be on cholesterol medicine.
And those medicines, the statins, are they the main one?
That is a mainstay of therapy, the statins. We have some other medicines now, including injectables, that are very, very effective. And so you work with your doctor over time to come up with a good regimen.
How about blood pressure? How important is that as far as follow-up long-term, somebody that's had a heart attack?
Yeah, very important. So we want blood pressure controlled, blood sugar controlled, and blood cholesterol levels controlled.
Now, the blood sugar, you want that controlled because of what?
There's a powerful interaction between diabetes, between high blood sugar and plaque buildup and heart attacks.
Yeah, I think when somebody goes to the doctor and their blood sugar is elevated, I had a physician tell me one time, that's a wake-up call. It's a time to really start looking at your cholesterol, your blood pressure, your activity, because you're walking toward a heart attack if you don't get that blood sugar under control.
Well said, absolutely.
So the whole thing is, it's really, to me, it's a way of teaching people good health, the things that they really know. They know you need to be eating properly. They know that you need to stay away from fried foods and greasy foods and eat more fruits and vegetables. Is that correct?
Absolutely. So we like really ideally a plant-based diet, but or Mediterranean diet is really excellent.
When you say plant-based, what do you mean?
As much produce as possible. So fresh fruits and fresh vegetables as a mainstay in the diet. That Mediterranean means some lean protein. So lean protein and good produce.
How about salt?
Careful with the salt.
Yeah.
It aggravates blood pressure in particular, and if they're susceptible to congestive heart failure, that the salt aggravates.
So if you take 1,000 people have had heart attacks and you put them on a good program, well, what percent will respond to the treatment of proper nutrition, proper exercise, proper weight control, proper control of your cholesterol? I mean, it's a lot to do for a person.
It is a lot. It pays off. And if they'll do that, the success stories are wonderful. Plaque in the arteries shrinks up.
Does it really?
Yes, it's called regression or reversal of plaque. And it's very exciting. That's why we try to achieve all these goals.
So if somebody had plaque in their coronary arteries, do you redo a cath sometimes to see how the patient's doing, or?
We do that in studies. Typically, if they're doing well, they will not need a repeat cath. And sometimes they ask, how do I know if the plaque has shrunk up? And we look at that in some indirect ways.
How often does a patient come back to you and say, Dr. Foster, I want you to know you saved my life?
It happens fairly often, and it's heartwarming.
You know, to me, it's the most gratifying, fuzzy feeling that a person can get when the patient takes the time to say, you saved my life.
Yeah.
Malcolm Foster, you're a great teacher. Thank you for teaching us about a heart attack and what we can do about it, the importance of 911, get through that emergency room quickly as can.
Yes, sir.
You're a great teacher.
Thanks, Dr. Bob.
A lot of great information, and now you're going to want to stay tuned. We're going to be talking about, do you know that hearing problems can actually lead to dementia? And so we need to pay attention to our hearing. And also, what does the pulse tell us? Do you know how to take your pulse? Do you know what information it can give you? A whole lot of information. You want to stay tuned. I want to thank Dr. Malcolm Foster. Wonderful discussion on a heart attack. And remember, time is muscle. Chest pain, 911, get to the emergency room. Now, questions from you, the viewer, that I think are important to your health. Dr. Bob, my wife says I need to get a hearing aid. My wife has said the same thing. How important is that? Well, we know more and more that hearing is very important to the development of the brain and for the brain to be able to store information. Hearing loss is very, very common. As people age, they frequently lose high frequency, so they can't hear a high-pitched noise or sometimes a soft voice of the wife. And so sometimes the wife saying you need to have your hearing checked is a very important thing for your health, because if we do have hearing problems, and what are some of the key indications of that? Well, you have to say, but you don't understand somebody. You say they're talking too fast. Or when you're in a room where there's a couple of conversations, you really can't hone in on one. Those are all indications that you may be getting some high frequency problems, and that can be corrected and it can change your life. Hearing aids are getting much, much better. If you decide that you need to get your hearing checked, you should see an audiologist and they'll do hearing tests. There are 2 or 3 types of hearing problem. One is sensorineural, and the other one is conductive, and the other one is mixed. So they'll be able to tell if there's something blocking the ear canal, like wax in the ear canal, or like there is a problem on the inside of the ear there. And they'll also be able to tell if the hearing nerve is doing what it's supposed to do as far as your ability to hear. If the decision is made that you need a hearing aid, there are wonderful advances in hearing aids. Initially, they were just magnification. They just made it louder, and so the whole room and noises everywhere were just louder. It was very difficult on people. Now they're getting where they can differentiate noises. They've got where you can turn them down in certain circumstances that you are, and hooking it up with your cell phone. So the advances that are available to get your hearing taken care of are immense. Now, if you don't take care of it, then the processing of the noise and the information that comes to you will be inadequate. It makes people actually depressed. It will make them sit back and be lonely, where they won't really access conversation and social environment well. And it can really lead to huge problems. So if you even think you've got hearing problems, get your hearing checked, and then you'll be able to know what you need to do. Good luck. Question number 2, Dr. Bob, why does the doctor always take blood pressure and pulse? Well, there's huge amounts of information that we can get from the blood pressure and the pulse. We know if the blood pressure gets high, then it increases the incidence of heart attacks and strokes. So we want to get the blood pressure lowered down to a normal. Well, the only time I get a high blood pressure is when I go into the doctor's office. Well, it's probably the only time you get it taken. So pay attention. Don't blame it on white coat syndrome. If you've got abnormal reading at your doctor's office, get a blood pressure cuff that you can use at home. There's an Omron IntelliSense. It costs about $100, but you'll be able to measure your blood pressure at home. Now, how about the pulse? The pulse can give us huge amounts of information, and we should know how to take our own pulse. The pulses, there's a pulse in the wrist, there's a bone, there's a ligament, and there's a little valley in there. And that's the area where the radial artery, where every time the heart beats, you'll be able to feel a pulse. You can feel it in the carotid artery in the neck, the temporal artery on the side of the head, and the brachial artery in the elbow area. So all of those are places where you can get a pulse. So what good does that tell you? A normal pulse, 60 to 100. So if your pulse is getting too fast, there may be a reason. It may be that your thyroid is too high, or that you're having some problems with infection that makes your heart rate too fast. You should be able to feel the character of your pulse. It should be a strong, strong pulse that you can feel tap on your finger. So I like to take my pulse frequently in the neck and in the wrist, because in those two places I can get a good feel and a good idea, I think, of what my blood vessels are like. So if your pulse is irregular, if there's a skipped beat, or if it's frequently skipped, you may have atrial fibrillation. or your rate may intermittently go to 150 times a minute. So those are things that can really help your doctor. Know how to take your pulse and know that taking that pulse may be the avenue toward good health. It's all the time that we have for this show. Remember those 4 things that we like. Exercise, how important that is. Reduces stress, it reduces your blood pressure, makes you feel better. We get a runner's high. It makes us where we want to continue to exercise. 7.5 hours of sleep. If you're not sleeping well, talk to your doctor about why. Pain can keep you awake, medicines can keep you awake, but a good 7.5 hour sleep will let the body rest and let you function better. And eating properly, we talked about that with Dr. Foster. Mediterranean diet, more fruit, more fibers. The foods that we know we should be eating. So make sure that you've got a lot of green leafy vegetables in salads in your eating pattern. And most of all, what is it we like in the Dr. Bob Show? You're right. It's that laughter in your life. Laugh a lot, giggle a lot, have a good time, enjoy life. And the happier you are and the more you laugh, the healthier you're going to be.